Okay, so I just want to thank you, Dr. Lavelle. And those cases were very interesting. I just want to add at the end, just to highlight, when we talk about our mechanism of action, and you talk about surface area and where does the nanotechnology come in? Well, you know, the if you took a gram of our material, the surface area in of that of the nanobone would be equivalent to the size of a tennis court, which is kind of amazing. And you hear about a lot of products nowadays that have this surface chemistry, that surface chemistry. But when you think about nanobone and you got these individual wafers, each one of them, nanoparticles surrounded by a silica matrix, which is replaced by an organic matrix, which contains all of these osteogenic factors. I think that makes us a very robust mechanism. And as we've seen, that we're getting, uh, maybe earlier mineralization and bony healing. I want to mention that we have started this year a kind of a robust clinical program. We've got a couple of, I guess, well, level 2 controlled studies. We have a controlled study going on in University of Massachusetts. We are negotiating for basically maybe a level 1 or 2 study in cervical spine in what is it, Illinois, and we're going. We also have what we call patient registries, where we're kind of just getting an influx of all cases and things like that. So we are actively demonstrating we're out to prove what we say. And I guess with that, I'll open it up now for questions.
I just wanted to say one thing about NanoBone. We're dealing with older population, smokers, people with comorbidities. The nanobone doesn't wash out like the other synthetic grafts. It's going to stay in situ, which basically gives you a longer term for fusion. So like you said, that 1 year you can have a 70% fusion rate, which is probably lower in the lumbar spine, but the nanobone is going to remain in situ, whereas the other allograft, autograft is going to resorb, and then the BMP is going to proliferate in ectopic fashion or non-structural fashion if left in situ with a non-union or a non-fusion. So with BMP, you're in a race against time before it turns, into a negative consequence. Whereas like the nanobone allows you for a longer period of time to allow for fusion to occur, even if you have smokers, even if you have somebody with medical comorbidities.
That's interesting. Uh, I was going to comment on something with Dr. Lavelle. Talking about cervical fusions, a lot of the studies that are out there, and even those that have been, where you have the independent radiologists done by medical metrics, they're basically on 1 or 2 level, disease. And when I had been involved in a couple of IDEs for devices and artificial discs and things like that, and I found that when you go from 2 to 3 levels, the success rate drops off pretty significantly. So those 3 and 4 level procedures are much harder to get a high success rate than the 1 or 2 level. Uh,
Yeah, and I would agree with that, and it is one of the things that cautions us to consider supplementing a fusion from a anterior posterior standpoint. That being said, there's nobody has great data on 3 and 4 level fusions in terms of product. Right now, if you think about the onus for approval studies, honest approval studies are to get them to get a device on the market, or get a product on the market, or to get a product and indication. I think you're going to see more transparent data in the next 10 years about what works and what doesn't. A couple of initiatives, the American Spine Registry is an initiative. You're also going to see data from bone grafting products to try to position them. One of the things that has happened is over time, there's been a drive to only reimburse things that are on label. And that's been something that I was on another think tank type of meeting about 2 weeks ago. That was some of the middle Atlantic states were starting to see insurance carriers not approve surgeries if they're using an off-label indication for a device, such as using bone morphogenetic protein for an ALIF that's a non-approved cage. And so there'll probably be more of a drive to see transparent data like that. I also see there's a question on the chat line about how this is favorable to a gain share, the device. And I don't, speaking on the industry side of it, I don't know what to say, what not to say. So I'll open it to our industry partners on this. But I would find it shocking to find any institution where NanoBone greatly exceeds the cost of a cellular or a BMP product. So I'll turn that over to the industry's folks to chime in on that. But that would be how they would be positioned to be more favorable to a bundle or gain share agreement. Is the relative pricing for their product?
I'll answer that question. This is Paul Byerly. I'm the CEO